Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Victoria Leaphart. She is board certified in obstetrics and gynecology. She is also a member of the Washington Township Medical Foundation.
I've been with the Washington Township Medical Group for about 3 or 4 years, and when I joined the group I went to part-time and I started doing this, more community education and wellness education. In addition to being a gynecologist, I'm a member of the American College of Lifestyle Medicine, which is using nutrition and exercise and stress management to treat and prevent disease. My topic today is how you can improve your communication with your doctor and optimize your health care, because if you communicate better with your doctor, if your doctor communicates better with you, then your care is going to be better. And we're all frustrated with the state of medical care as it is now, with the lack of time that doctors have to spend with patients. We as doctors are frustrated, and you as patients are frustrated as well. So I'm going to talk a little bit about that, and I'm going to talk about the perspective of a doctor and what you can do to make our life easier and our ability to care for you better. This is what we all expect when we go to the doctor. Our fantasies of, a doctor who makes house calls, a doctor who knows the whole family, Marcus Welby. We all have that as a fantasy. And certainly in those days, medicine was simpler. There were fewer labs. There were no CT scans. There were no $1,000 a pill drugs. But we also died younger and sicker because there was less the doctor could do besides just provide comfort. The current reality is, for most people, it feels like the top picture, that you're trying to talk to the doctor and the doctor's staring at a computer screen. It feels like the doctors never run on time. They're just sitting in front of the computer instead of looking at you face to face. There's some truth to that, but not as much as you think. Currently, most doctors no longer practice solo or in small groups. Most doctors are in big groups. Kaiser, Sutter, the Washington Township Medical Group, which is what I'm in. And most doctors are employees, so they have little control over their schedule. And the average doctor sees 35 patients a day. Interestingly, the average visit length is 19 minutes, and that has not changed since the 1970s. In fact, in the 70s, 80s, 90s, your doctor spent as much time in the room with you as they do currently. But the nature of the office visit has changed. In a 2016 study, they followed doctors around with stopwatches to see how they actually spent their days, and only 27% of their office day was in direct face-to-face contact with patients. Half of their day was spent on the electronic health record, charting the visit, reviewing test results, logging information, writing medication orders, and that sort of thing. So half of their day was spent doing that. And when they're actually in the room with you, only half of the time that they are in the room with you are they talking to you directly face to face. About more than a third of the time, they're actually doing the electronic health record. On average, doctors spend 2 hours every night catching up on additional clerical work. So that's pretty typical. I know that I'm typically doing 2 to 3 hours of charting after my workday. My partners are as well. And so this is, life at home for most of us. And it's unfortunately the nature of the reality that we have. Because for all of us, we're trying to spend as much time face to face with the patients as we can, and that paperwork gets put to the end of the day. And so it makes for a long day. It's a frustrating day for the patients. It's a frustrating day for the doctors. I have to say that there are some benefits to the electronic health record. It allows you to access records of other doctors, particularly if you're part of a big system. I can access not only the records of the doctors in my group. I can access Kaiser, I can access Sutter records, including the Palo Alto Clinic, Stanford, UCSF. It does improve my ability to take care of patients, to be able to access those records, especially for complicated patients. And for our diabetic patients, that is certainly the case. If you can see the records of their nephrologist, their endocrinologist, their primary care, that patient's going to get better care. You've got a very brief time with a doctor. How can you optimize what you're doing with the doctor? One of the keys is to find a primary care that you trust. Now, for most people, their primary care is going to be their main doctor. That's going to be the person that knows everything that goes on with them, that coordinates their care, that sort of thing. If you have kidney failure and you're on dialysis, that primary doctor that coordinates your care may be your nephrologist. If you have very brittle diabetes that's been very difficult to manage, your endocrinologist may be the doctor that's really your central doctor that coordinates your care. But for most people, it's their primary care. And this is a busy slide, but I wanted to talk about if you're seeing a new doctor, what information you should bring. You want to bring either a list of all your medications and supplements, including doses, or bring a bag with all of your medications and supplements in it. It's extremely helpful for us because sometimes patients will say, I'm on something for my blood pressure. It's blue. And that's not helpful for us. Or they'll say, I'm on such and such a drug, and you'll say, well, what dose? And they'll be like, I'm not sure. So bring all that information with you, either as a list or bring your actual drugs. And we want to hear all the supplements that you're taking as well. Even if it's something that you're taking over the counter, we want to know about it. If you're taking glucosamine chondroitin, if you're taking fish oil, if you're taking aspirin, if you're taking any supplement, we want to know about it. And because some of the supplements can interact negatively with your drugs. We want a list of all your medical problems. Nothing thrills me more than having a patient who has a complicated medical history who brings me a list of their medications, medical problems, their surgical history in chronological order, and a list of all the doctors, including address and phone numbers, that they see. All of that information is really helpful for us, and if you can write it on a sheet or two of paper and just give it to us, we will scan it into your chart and we have that information. It makes our life much easier. And as far as past medical history, if you've had surgery, we want to know when it was done, what was the reason it was done, details about the surgery. For my patients, for example, if they tell me that they've had a hysterectomy, I want to know, do you still have your ovaries, or were your ovaries removed? That's an important part of how I care for that woman. And so we want those details. If you had cancer, a precancerous change, something unusual, if you have a copy of your operative report, your surgery report, and the pathology report, that is extremely helpful for us. And I would encourage all of you, if you've had something that's, especially if it's something that's not just a routine surgery. If you've had your gallbladder out and everything was fine, we don't need to know about it. If you had your appendix out and everything was fine, we don't need to know about it. But anything that's unusual, that's not routine, I encourage you to have copies of all of those. All you have to do is ask your doctor for those records. You are legally entitled to copies of all your operative reports, your pathology reports, your labs, all those things. And I encourage you to have copies of your medical records. And, it's very helpful if you see a new doctor. The other thing that patients oftentimes don't know as much detail as we'd like to have is family history. They'll know that their grandmother had cancer. They won't know what organ, or they'll know it was breast cancer, but not know age at diagnosis and how she did. Because if you get breast cancer at 80, we're not particularly concerned about that family history. But if you have relatives who had breast cancer when they were 30 or 40, we're very concerned that you might have a genetic abnormality that would predispose you. So family history is important and we like to know age at diagnosis, that sort of thing. I encourage you, when you go to see the doctor, take a pen and paper so you can write notes. I keep little pads in my office so that I can write notes to give to patients for things that, if it's a word that they don't know, a diagnosis they don't know, a medication they've never heard of, whatever. I'm writing notes all the time to send home with people, because you leave the office and you forget what was the name of that over-the-counter supplement your doctor remembered. I would also encourage you, especially if your medical history is complicated, to think about bringing a friend or a family member. Sometimes having an extra pair of ears can improve your ability to retain that information that you're getting in that very short doctor's visit. And the other thing, social history, we always ask, how much alcohol do you consume? How much tobacco do you consume? Any other drug use? Be truthful with your doctors about that. We can take better care of you if you're honest about those things, and be truthful about how much you're exercising. And be truthful about whether you're really taking your drugs. Because, if you're trying to save money on your prescriptions and you're taking one of your diabetes pills every other day, the doctor's going to wonder why your diabetes is in poor control and think, oh, do we need to add another medication? No, you don't really need to add another medication. You need to be able to afford to take the medication that you're on correctly and maybe switch to a cheaper drug, something different. So be truthful about whether you're really taking the things that are prescribed. When you go into the doctor, any doctor, for any visit, I encourage you to write down what you want to discuss with the doctor. It's kind of a joke that people bring this giant list and they have a whole lot of things that they want to talk about. It's a lot easier if you can just look at a piece of paper, because otherwise you forget what you wanted to ask. And you should write down what questions you have in order of importance. And I encourage you to do a little research from reputable sites ahead of time so that you can ask questions in a more focused way. The doctor has their own agenda about what they want to cover in the visit, and so sometimes you have to bring them around to, the doctor's like, wow, I'm really worried about your cholesterol. It's like, maybe you want to look at the patient and see that they've got arrows in them. So you want to be sure that your concerns are addressed early in the appointment, because your first concern, your first question, that's why you should write them down in order of importance. The first question that you address with your doctor gets 5 minutes of attention. The second question and all subsequent questions get about a minute. So that first question that concerns you the most, that's the one you ask first. And don't wait till what we call the doorknob moment, when the doctor's walking out the room, has the hand on the doorknob, and you're saying, oh, I just remembered one more thing. Because at that point, the doctor is on the way out, and you're going to get their full attention at the first part of the visit when they first walk in and address you. So that's when you ask your most important question. And if you feel like it wasn't addressed, ask again. If you have symptoms that are concerning you, be prepared to talk about them. How long have you had pain? How severe is the pain? What's the quality of it? Is it sharp? Is it dull? Does it come and go? Do you have other symptoms with it? Do you have a fever? Do you have pain with urination? Do you have cold symptoms? So be prepared to give some thought to the nature of your concerns, when they started, how long you've had them, what the nature is it getting better, is it getting worse over time? And if you write it down ahead of time, again, because sometimes when you're in the middle of the visits, you get kind of rattled. You know, the doctor's trying to hurry you through, you get rattled, and you realize, I didn't get to say what I wanted to say. If you write it down, you have it in a piece of paper in front of you, you're less likely to get rattled and get off track. It makes life easier for you because your concerns will be addressed, and it makes it easier for your doctor. Because if you've got a patient who says, well, I don't feel right, and their symptoms are very vague, it can take a long time to sort of sort through those symptoms. And if you have a patient who comes in and says, I have a pain that started 7 days ago, it's gradually getting worse, it's stabbing, it's intermittent, you know, it makes our life easier, because then we have more time to actually sort through what's going on with you. At the end of the visit, if the doctor has told you you have X, you need to be sure that you understand what the diagnosis is. Do you understand what's wrong with you? Was the diagnosis explained in terms that you understand? If not, ask the doctor to clarify. We assume that you understand what we're telling you unless you tell us that you don't understand. If you don't have a firm diagnosis, then you want to understand what the next step is. What's going to be done to come to a diagnosis? Are there tests that need to be done? What's the next step? We encourage you to ask questions, because we think we're being clear, but sometimes, you know, we graduated from medical school a long time ago, and terms that seem normal to us, we forget they're not normal English terms. So sometimes we forget that a medical term that we use casually because we talk about it all day, every day, is not normal common language. And sometimes we have to be brought back to reality a little bit. And so if we're telling you something that you don't understand, ask us to clarify. Because we want you to know what's going on with you. We want you to know what the next step is, because you're going to take better care of yourself. If you leave the office not understanding why we want you to do an ultrasound, you might not do it, and your care will suffer. If we've explained adequately why it should be done, your care is going to be better. Ask questions about the advice that you're getting. We all tell our patients, exercise, eat right, all of that. I love the bottom left one. I think diabetes is affecting my eyesight. I have trouble seeing the consequences of my poor food choices. And this one, I feel this way sometimes when I'm talking to patients. Oh, I have the solution to all your health problems. All you have to do is change everything about the way you live. So I encourage you all to be honest about what you can do and what you will do. Because, don't tell the doctor you're going to exercise for half an hour every day if you're not. Be truthful with the doctor. Say, I'll start off with 10 minutes a day. I'll walk 10 minutes a day. I'll commit to that. I'm not committing to more than that. And it doesn't fit into my schedule or whatever. Or be truthful that I can't walk that long. My knees really bother me. That's not possible for me. We need to come up with something else that I can do that's not going to be injurious to my joints. So be honest about what your time limitations are, your physical limitations, and your psychological limitations. If you hate the gym, don't commit to going to the gym. Find something else to do for exercise that you enjoy. Don't commit to something you're not going to do or that you won't do long term. New prescriptions. Anytime a doctor suggests that you take a new drug, ask why this drug. Is it better? Is it cheaper? Is there something cheaper that's been around longer, that's been studied more, that's equally good? Because oftentimes we give out samples of drugs, and the drug companies give us samples of their new drugs, the ones that are still on patent. So they're expensive. They don't give us samples of their old drugs and the ones that have gone generic. There's no benefit to them to give out those samples. They give us samples of their new, expensive, brand-only drugs. And so oftentimes you end up sort of into this spiral. The doctor says, oh, I've got this great new diabetes drug, you can try it. And then you're like, oh, that really controlled my diabetes, but it costs a fortune and it's much more expensive than your older drugs. And the question is it really better than your older drugs? Is it safer than your older drugs? Is there a reason that you should switch to this new drug? And what are the side effects? How long will I be taking this? Will it interfere with my other medications or supplements? And are there non-drug alternatives like diet and exercise? Like this one. Oh, here's a new drug. Oops, guinea pig just exploded. Well, maybe we'll stick with the old one. I'm a big believer in not giving patients brand new drugs that have just come out, because oftentimes they haven't been around long enough to really understand the long-term consequences of these drugs. And I'm a big believer in kind of waiting until it's been out there for a while. I like this one. Well, this drug is going to treat your arthritis, but it might give you heart disease. So then we'll give you a drug to prevent the heart disease, but that might give you kidney problems. So then we'll give you a drug to prevent that. And, down you go, taking a whole list of drugs to treat the side effects and risks of your other drugs. Ask about tests that are ordered. Why is the test ordered? Is it going to change the management of my care? Is it going to change my diagnosis? And is this the best test? Is this the test that's going to give us the most information? If a test is ordered but isn't going to change your management, then really why are you ordering it? If it's not going to change the management of your care, if it's not going to change your diagnosis, then why is the test being done? Especially for expensive or invasive tests, is there another way to get that information that's less invasive, that's easier? And sometimes you don't need a test to make a diagnosis. Offhand, I'd say you're suffering from an arrow through your head, but just to play it safe, I'm ordering a bunch of tests. Sometimes it really feels that that's what your doctor's doing. So ask those questions, especially this one. If you're going to have an invasive procedure, a surgery, some other invasive procedure, ask, do I need this procedure? Is there an alternative? Is there something else that I could consider? Because doctors make mistakes. Sometimes they make mistakes of judgment, and sometimes they'll offer you a surgery that they rarely do, and you might be better off seeing somebody who does that surgery often. And especially when somebody suggests something invasive, it's never a bad idea to get a second opinion, especially for major surgery. And it is not rude to ask the doctor for a second opinion or ask them how often they do the procedure. We live right near UCSF in Stanford. These are great resources for second opinions, for rare or unusual surgery, difficult diagnoses, complicated patients. We live in a place where we have access to amazing care. We are at an exceptionally good community hospital, and we're in an environment where we have two major universities within an hour of home for us. I encourage you to take advantage of those things. Become an expert on your condition, particularly for my patients that have unusual things, that have unusual diagnoses, unusual syndromes. They always know more than I do. They can educate me about their unusual syndrome or condition. And we encourage you to know as much as possible about your own disease, your own process, and use reliable sources for medical information. There's a lot out there. I mean, there's some wacko, websites where you can get some really crazy information, but there's a lot of really great information out there. The American Diabetic Association, the National Institute of Health, the Cleveland Clinic, Mayo Clinic, Harvard, they all have great websites, and WebMD, AARP, they're not bad, and there's some really good places to learn about your illness. Ask your doctors, is there a website you recommend? Is there a place for me to get more information about this? But at the same time, don't drag up all sorts of wacko things to your doctor that, oh, this website says I should try this crazy alternative thing. Go to reputable websites. And oftentimes, you will know more than your doctor, especially if you've got something unusual. So this is really the goal. You have a rare condition called good health. Frankly, I'm not sure how to treat it. But honestly, that's not realistic for most of us. As middle-aged adult people, we are all going to have chronic medical problems of some nature or another. We are all going to, as we age, accumulate more doctors, more medications. It's just the nature of aging. But we can optimize our care and maintain good health with the care of our doctors. It just might take more doctors and more medication than it did when we were 20 years old. But this is still the goal, for us to be in good health in spite of our medical conditions. I want to recommend this book. Leslie Michelson, he is the author of The Patient's Playbook. He is a consultant who spends all his time helping wealthy people access the very best medical care that can be had for any amount of money. But this book is about how you, as an ordinary citizen, can do this for yourself and access the very best medical care. And a lot of what I've said today is from this book. It's a good book for optimizing your ability to become a savvy healthcare consumer. The hospital has had him speak to the administrative staff of the hospital, to the physicians. He's given a couple of community events because the hospital feels that his message is important. The idea that we should be empowering our patients to be good healthcare consumers. Thank you very much for allowing me to come speak to you.